Welcome everyone to IMG Research Academy, interview one-on-one preparation. We do this to prepare candidates, medical school graduates, doctors, foreign trained physicians, and also US-based physicians who will be having their interview sessions going into residency programs. We prepare candidates across the board from pediatrics, neurology, whatever subspecialty they're going into. We have these one-on-one sessions, usually paid sessions where we target different components of a candidates, either the confidence, the content of their delivery, how they should respond, appropriate responses, the philosophy of an interview, the mindset of an interview, composure, comport, connectivity, and so many other things. Today we have one of our top ranking candidates who's a recent graduate, has been doing well. And we're happy to partner with him on this journey. He's giving us permission to actually also record this and share it. So this is supposed to be a private session, but just for knowledge sake, we're going to share the first 10 minutes so people can have a snippet on what we do and also learn from how we do it. This is his first session, and going into interview, in this session, Dr. Steve, we're going to talk about how to actually prepare for an interview, a Zoom interview. Okay. After the COVID, or during the COVID session, interviews transition from in-person physical to, virtual, especially so many things in the world. So a lot has changed. Before they could feel you, they could feel your presence, and measure who you are. But now it's mostly on Zoom, right? Or on virtual platforms, either Thalamus or whatever it is. But the way we want people to prepare for this interview is to prepare as if you're coming in person. So there are components of the preparation that we're going to go through, right? Let's talk about technicalities first. From the technical aspects, we notice that, or from experience, we've seen that the way you look and the way you appear has an intrinsic bias, or people see you and judge you based on the way you look and the way you appear, right?
I see.
Without even hearing from you. So to lower the bias, or to reduce the bias that the interviewer is going to have, we advise that you do some certain things. First, dress appropriately. One, come on time. Two, dress appropriately, right? Good tie, neutral color, nothing too shiny, nothing too neutral color like blue or green. Not green, I mean sky blue, neutral official color. Good tie, good hairdo. Beards, if you have, make it clean. For people who are old graduates who are coming to interview, if they graduate for a long time, I would usually prefer them to shave their beards. Not because having beards is not good, but we want them to look young and trainable, right? Most program directors are young people, and there's this bias talking to an elderly person, very elderly person. They kind of in their mind are wondering, is this person going to be trainable? So everything to reduce that or to deflate that perspective, or that perspective that you're not going to be trainable should be removed. So come clean shaved. In terms of posture, because the way you position yourself in a Zoom interview also tells so much about who you are. No slouching, no dipping, no, we have different ways of sitting. Confident look says sit up confidently. And to show sit up and confident, you notice that when people come to Zoom, there's so many ways Zoom appear. It can appear like this. Right. This is not good enough. It doesn't show that you're slanting. A Zoom can also appear like this. Yeah, do you like this? You've seen a lot of things. So the what we recommend technically is for the Zoom to be a little bit below your bust level, just a little bit, just like the way you are, right? It shows like your passport picture. There should be a little distance between your head and the frame of the Zoom. And then as much as possible, there are different sitting positions that you go to the side and let one side show. You go to the other side and let the other side show, or you stay in the middle. I prefer the middle one, right? It removes over sophistication to the whole process. Except there's something you want to show, like that word family, you want to show by the side, the plant that you want to show. The backgrounds, we usually say, keep it simple and neutral. It shouldn't be crowded, it shouldn't be distracting. The focus should be on you,
Right.
not on the plant, not on the whatever. So like this
Right.
plant, it's a little too much. In my perspective, some other person will say it's not too much. It could just be a little bit away from the view, right? So
Okay.
that only the
Okay.
the slanting little things can come out from the side. You get what
Okay.
I mean?
Yeah, I
Um,
do.
we've seen a lot of Zoom positions, Zoom positioning also. People sit high and then looking at the Zoom like this. It's wrong because most tables
Okay.
that we have are not in our eye level, right? So we try
Right.
as possible to tell people, keep this in an eye level. For me, I use boxes. You can use tables, professional table, laptop hangers, and raise your laptop up to almost your eye level or if not your eye level. You see, this way, I'm looking at you directly like this.
Right.
I'm not
Right.
staring at you down or my head is slanting up like mango. You want to give that professional look, boss level kind of eye something. And another thing is on a Zoom interview, you look at the camera. This is the
Okay.
camera. Right?
Right.
Was a culture in these Western countries, and which is one of the reasons why we started this program. We've helped over 300 to 800 people, I'm not exaggerating,
Wow.
in preparing for interviews at different sections.
Mm.
Um, is that some cultures they differ. Now the culture
Right.
in the Western countries, especially in the US, is eye contact shows genuineness. Of
Yes,
course, you know that you've been in the
that's
Western
true.
for a long time. So for me to maintain eye contact, in person I can maintain eye contact, but in Zoom we often look at Steve's face on the screen,
Yeah.
and then you notice that I'll be looking like this, weird,
Right.
right? You want to, as much as possible, keep your eye on the camera light, as much as possible,
Mm.
and ignore his face, maybe
Okay.
as much as you can. For some people who cannot, we try to stay at arm's length. When you stay at arm's length, it's difficult to tell where my gaze is.
Right.
You know what I mean? It's difficult to tell my
Yeah.
gaze. So it looks like I'm looking at you and everybody's also, doing the right thing, keeping that eye contact. Another problem we notice in Zoom is because of the way we put our cameras, oftentimes they look as if we're looking at the side,
Mm.
right? It looks as if we're
Okay.
looking like the side, like the way I'm looking. As much as possible, if you can correct those intrinsic technicalities, do that. If you know how to use a microphone. But don't use a microphone for the first time when you're using Zoom. If you've never used a microphone before and you can project your voice is audible enough, project it, use it.
Mm.
If you want to use an
Okay.
earphone, use it. But let it not be the first time that you're doing these technicalities. You must have practiced it over and over and over again, right?
Right.
Why? So that you can know how the microphone sounds, your microphone settings. It's not that day that you begin to come and hurry. Is my microphone working? Is not my microphone working? Those failures in technicalities, they throw your adrenaline up and then they distort your thought process and then they make you not settle, right, for the interview. So we're talking about some technicality. We're still on technicalities. You have to be on a quiet room, very quiet room, of course. Of course, you should be in a quiet room, right? It's common sense. But I
Yes.
tell you, on that day, people still have their kids running around, their wife banging into the room, people trying to stare into. Look, this is real, and I've seen it happen several times. And you'll be surprised that these things are happening. This person's in a
Yeah.
kitchen, you know, cats running around. Yeah, cats should run
Mm.
around, but cats should not run around. This is a serious day, right?
Right.
In
Mm-hmm.
your interview,
Mm-hmm.
you got to focus. Let the focus be on you. So those are like
Right.
some few technicalities that I will
Okay.
mention. We've talked about coming on time. Another part, the philosophy or psychology of an interview is that almost everybody comes in tense. So, and that tension, the epinephrine, the adrenaline, whatever throws up tension, has a way of um, making you not to sound real and normal.
Yeah, it's true.
You
I
need a
agree
little
with
bit of
you.
that tension. You need a little bit of it. But we also need dopamine, the happy hormone, to make you relax, right?
Right.
It's going to be a combination of, a little bit of each, just to keep you very relaxed and normal. Okay.
Okay. Okay.
How do you now develop this relaxed mode? One, practice and practice and practice and practice and practice. Our session offers 5 to 7 sessions, which is not enough. There are over 1,000 questions that can be asked, variants of questions that can be asked in an interview. So in between these sessions, Steve, we need you to practice. Look for a guide, your partner, your wife, the mirror, your phone, hire a professional like me. So many things you could do. Get your peers. Usually we prefer you practicing with your peers who are physicians because you're going to be talking, to physicians in an interview. Practice and practice
Right.
on very tiny things. And then we're going to create a practice plan for you, right?
Okay. Okay.
Usually at the end of the day.
Oh, that would be great.
So if you practice, and mastery has a way of building confidence, I'm very confident. I've gone through so many questions. No matter the shade of question that they're going to throw to me, at least I understand the principle of answering it. Some people will say cram, and other people or memorize, because in the British English we use cram. Here we don't encourage memorization, because if you fail, forget one line. If you're not that good in
Yeah.
memorizing, you forget one line, throws your balance. So what we
Yeah. You
focus
begin
on,
to panic.
exactly, you begin to panic. What we
Yeah.
focus on is understand the principle of answering each question. Understand the question and the principle. So there are different types of questions, and we're going to go into those categorizations of questions. Okay.
Okay.
So
Okay.
another way to make yourself comfortable in an interview is to come in with a smile.
Okay.
Now, what we've noticed over the years is that the interviewer's perception about you goes a long way in determining how he analyzes the content that you say. If he
Right. That is
perceives that
true.
you're smart, lovable, enjoyable, relaxed, normal, everyday, easygoing, walkability, somebody that they could walk around, your responses will be great to him. If
Yeah.
you come
It's
in
true.
firm and stern, many of us who come from foreign countries, because of the stress we've passed through our life, you know, fear, cultural adaptability. We're already
Right.
prejudging ourselves before we even get there, like the conversation I was having with you. We're not adequate. We're coming with an inadequate feeling. Are they
Right.
going to hear me? Is he going to like me? And then we come
I
in
know.
tough. And other people also have normal anxiety disorder, right? And if there's
Mhm.
something that you can take for anxiety disorder, if you have ADHD like me, then it helps you to do well, do it, right? That's what
Right.
we recommend, especially as long as your doctor, we're not giving a medical recommendation, but if it's breathing exercise that helps you to calm down, if it's walking around, listening to music, some Christians speak in tongues and it helps them to calm down, other things that you need to do. Um, Interviews are very technical. So there's within 20, 30 minutes, you're going to dissipate a lot of ATP. So we encourage you to take something that will boost you, because if the brain is fatigued, you're just going to be
Yeah.
floating.
Yeah. It's true. I agree.
You're just going to be floating. So for
Yeah.
me, I eat. Eating doesn't make me
Okay.
sleeping. Some people, they eat and they sleep. For me, if I eat, it re-energizes me. I take boosters, right?
Okay. Okay. No, I do take coffee and some protein bars. Those are the things that keeps me awake and they break down gradually in my blood, so they don't make me sleepy at all.
Absolutely. Absolutely.
Yeah.
So in these technicalities, I need you to get a paper and pen and make a list of all these things we mentioned, because it's easy to forget. Eye
Right.
contact, smile,
Eye contact.
right?
Yeah.
Eye contact, smile. Take a booster, whatever booster you want to take in the morning. Just don't take something that will make you high and then you begin to jump over the places. um,
Mhm.
so back still on the psychology of interview, the
Yeah.
impressions are usually made in the first 4 seconds or 8 seconds of
Oh,
meeting.
wow.
Yeah.
That's interesting.
And all these things I have mentioned, they all add to the impression. Your setting, your
Right.
sitting arrangements, your everything, your smile. Most times the interviewers come in like this. Their cameras are turned off while you're
Okay.
there. So while you're there, you
Hmm.
should maintain that baseline smile, waiting for him.
Okay.
Either writing on the
Okay.
paper or checking, just acting some academic kind of activity. Right?
Right.
And
Right.
there are different types of smiles. There's happy, laughing. That's not what we mean, right?
Yeah.
Everybody has what I call the baseline, home base smile. There's a way you put your
Right.
face that makes you look very acceptable, like you, right? You see
I
that
hear you.
fine boy thing kind of
I hear
people.
you.
Yeah, that's the way that for me, if I'm like this, this is my home base, but I look stern. So I tend to open my teeth. I'm not
Okay.
inside of me smiling. I'm just creating a cosmetic kind of
Right.
look. So that the first 5, 10 seconds, 8 seconds, your impression about, oh, this guy is just chill, very happy, very relaxed, kind of walkable, easy, comes in. So I maintain that, and I might just be right. Even when you're writing, yes, because you don't know whether he's looking at you when his camera is off, he's making judgments, he's looking at your resume, he's doing a lot of things. For a lot of people,
Right.
interview days are the first times that people look at their resume, actually. Other programs that are thorough look at your resumes before, but the people that are going to interview you look at your resumes for the first time. Another thing
Okay.
about psychology of interview is lighting. You have to
Okay.
light up yourself, right?
Right.
A dark person in a dark room creates an intrinsic bias. I don't mean to be racist, but this is a reality that we come across. They
No,
see
I
us,
agree
they
with
think,
you.
yeah, they see us, they think that we're not knowledgeable, right?
Yeah.
That bias is already there. The way we sound, they think we're not intelligent, right?
Yeah.
But we
Yeah.
are. We are top
Exactly.
10% of the world intelligent
Yeah.
people. We are physicians,
Yeah.
actually. Most of us have experience in other different field, like Steve now has had experience in accounting and in different field before he came into medicine, right?
That's correct.
Yeah, so people kind of they prejudge you based on your skin color, based on your tone. I don't lay emphasis on all those. I don't do all those racial profiling, but these are realities that we face in life.
Oh, it's real. It's real.
Yeah, and it's good to see that. So lighting up yourself, get a
Yeah.
little light, put it behind your camera. The up-hanging light that usually are in most country uh, houses, remove that. The light should be beaming behind the camera.
Yeah.
Steve, you see the light shades in your place? Some light there, some light there. It should not be. It should be a monochrome light. So that
Yeah.
window that is reflecting that light that is striking a line, you should get a white blind. A white blind like the one behind me, like this, has a way of
Right.
bringing light neutrally.
Yeah.
So it's don't worry, we'll do that now. We'll do that
Okay.
in the second visit. This is just practice, right?
Okay. Okay.
So lighting, lighting, very, very important because you're
Okay.
trying to improve perception. Everything you can to
Right.
improve perception so that his
Yeah.
impression in the first 2 minutes, first 4 seconds, or whatever, it's clear and crystal. And this things really
Okay.
don't cost a lot. How much is this? Like $20, like
Yeah.
$5.
I bought this one for this is a very large one I have here, and it
Yeah,
just $25.
yeah, exactly. Light up yourself, right? Um, and then the last thing I want to say is we've noticed, this might be anecdotal, right, that there's a connection between your facial muscles and how your face appears and what you're
Okay.
thinking. If I'm
Yeah, I
thinking
think I
that,
agree.
if I'm thinking that Steve is not going to like me, he's not going to hear me, I'm scared of him, there's a way my face will be. If I'm
Right.
suspicious of Steve, there's a way my facial muscles unconsciously will arrange itself. Like I'll have
Yeah.
that suspicious look. So we want
Yeah.
to remove anything that will show fear, anything that will show tension, anything that will show doubt from our face, but it's usually hard to do. So because we know that there's a connection between the way the brain processes information and the facial muscle and how they arrange, a spatial arrangement of the facial muscles, we kind of say, choose a happy moment
Right.
in that place so that the brain intrinsically will be stimulated by, for example, I like your glasses. I truly
Right.
like your glasses. Your eyeglasses, I truly like it.
Okay. Thank you so
So
much for that. I love that
it tells
compliment.
me something like pleasant about you, and then my facial muscles will relax. For every interviewer, look for
Mm.
something around the person. You may not necessarily tell the person, his hair, oh, I like this girl, it's a beautiful girl. And then
Okay.
your face will just light up. Oh, I like this woman, oh, she's so cool. And somewhere
Mm.
in your face, you'll light up. Oh, I like that painting on the wall. I like her glasses. You know,
Right.
don't tell them that you like their lipstick because that's something out of
Yeah, you're looking for trouble.
you're looking for trouble, right? So, but just so the essence is to ignite your facial muscles to be relaxed and composed.
Mhm,
One other trick we
mhm.
use is in entering the meeting, strike up a conversation, very short conversation. For example, let's enter the meeting. Hi, Steve.
Hey, hi.
Good. You see, so you stopped, right?
Yeah.
Strike up a conversation. Hey, hi, Dr. Kobe. Should I call you Dr. Kobe? How do I pronounce your name appropriately? These are just some tricks to use because you want to de-stress. How's your day
Right.
going? Oh, my day is going.
It's been a very busy day, but you know what? I'm happy to be with you this morning.
Exactly. So that first intro, strike up conversation. But if you've not had these trainings, many people just come in and then they're frozen. They're waiting for the next fire question. They're frozen, right? Defreeze yourself by striking a very short, very formal, nothing informal. And formal things are, hello, Dr. Steve, how are you doing? How's your day going? How's Miami? Great. How's Tennessee? Oh, awesome. Don't go beyond, oh, Tennessee is fine, and then the weather is great, or everybody, except he's a chattery type. And
Right.
when you come, you're going to see his chattery type. Oh, Miami is great. I feel I'm glad to be here. Thank you. All right.
Yeah.
And then the final things in these technicalities is just believe in yourself. No
Okay.
other person will believe in yourself. Fear is not going to do you any good.
It will not. Yeah.
It's not going to do you any
Fear,
good. You're
fear
already
is
here.
actually a killer.
Yeah,
Fear is
you're already
actually a
here.
killer.
It's like being in the war front. You're already there. I mean, what's the worst that can happen? They shoot me. All right, let's go. There's no
Yeah.
turning back. I turn back, they're going to shoot me. I face front, they're going to shoot me. So I'm here. Let's do it.
Exactly.
Might be a
Face,
very
face,
wrong analogy, but
yeah, face your fear.
yeah, you face your fear. You're already here. And believe
Yeah.
in yourself. Because if you believe, somehow the universe arranges the thoughts and the contents. But if you're scared, we already know this fight, flight was the FFF response.
Yeah.
The fear, fight, and flight. The thoughts
Yeah.
will fly away. You
Exactly.
won't finish the interview on time. You're not going to be
Yeah.
relaxed and then you're not going to enjoy it. Enjoy the interview, enjoy the questions, enjoy coming up with the answers. And so many other
Yeah.
things I want to talk about. I don't want to bore you. This is our introductory class. Thank you for volunteering on doing this. Before I
No
end,
problem.
the interview sessions are usually done this way in terms of modality. First, they may have one session dedicated to everybody where they all introduce themselves and talk about the program, and then they will split into subdivisions or
Okay.
subrooms, right? Just
Okay.
like the way we do it in have you attended our
Yes.
rooms?
Yes.
So the
Yes, I
person
have.
will come, talk about everybody, talk about their program, what they offer, their rotations, their shifts, and then you introduce yourself.
Mm-hmm.
Then eventually they split, they then assign you to
Okay.
different subrooms. Those
Okay.
subrooms may be told to measure some specific things about you. And those subrooms may
Wow.
also not be told to measure some specific things about you. Let's say some people will be measuring your clinical knowledge, other people measuring your research knowledge, other people measuring your workability and how easy to you work with, other people measuring your intelligence and how you process information.
Right.
Or they all might have the same standard question cut across.
Right.
And then they will now compare notes, how you did to make sure that you were just not one time good and another time bad,
I
right?
got you.
And then what they usually do is that they have a scoring system.
Mm-hmm.
People that score highest, they rank. And the people that score middle, they keep on pending list. And then the people that score lowest, they don't rank. Plus other ways that they decide to rank. We're not going to go into that. That's another topic, ranking. But interview plays a very significant role in ranking. Once
In
you get to the
ranking.
interview stage, the program thinks that you're worthy to come to them. They just want to hear from you.
Right.
You get
If what I think about you is actually who you are.
it's actually who you are. So most people
Yeah.
that have gotten to an interview, say, I call it the 50-50 stage. You're
Right.
way ahead. The only person that can fault yourself is now you, if you
Exactly. Yeah.
say
No, I agree
something.
with that. I agree with that
Okay.
100%.
Um, so I think I've covered the basics of, and so many things I may not forget as we go along. We talk about it.
Okay.
Now, in the interview questions properly, what do they ask? The whole principle of having an interview is to see if I can work with this person. That's why I'm having
Right.
an interview with you. Can I work with Steve? Bottom line,
Mm.
does Steve have what it takes to be in my program? Do I have what it takes to support Steve in his training? You see these three answers. Can I work with him? Does he have what it takes to be in my program in terms of can he deliver? Can he work with my team? Will he be destructive? Will he be productive? Will he be ingenious? Is he calm and easy to work with? Right?
Mm.
Can I offer Steve what he's looking for? What is he looking for? He's trying to be this. Do my program have the facility to offer it? Because if you don't have the facility to offer your dream, then I don't have to waste my time bringing you
Right.
into my team. Because when I bring you into my team and I cannot offer you that you've longed for, then
Mm-hmm.
you're not going to function well. You'll be frustrated.
That's
That's
true.
why people switch residencies or people drop out or people don't do well because their dream and aspiration don't align with what a residency has. Residency has multicultural and they're coming to become unicultural kind of a person, physician. Their residency has not unopposed. The residency has some section because some residencies don't have all the entire, let's say family medicine, all the entire
Right.
spectrum. And then you were
Right.
expecting to get obstetric training, get this, get that, get this. And at the end of the day, they don't have that obstetric training to offer. You get frustrated and you begin to talk shit about the program. Sorry to use the S word, but yeah, really shit about the program, right? So
I
those are
see.
the things that
Yeah.
they measure in an
Okay.
interview. The questions are
Okay.
usually divided into, I call it the 40-60 theory. The 40,
Okay.
40, the 40% of the questions are fall along these four cardinal questions. One,
Okay.
tell me about yourself.
Right.
Two, tell me why this program. Three, tell me why this subspecialty. Four, where do you see yourself? Those are, to us in this academy, the four cardinal questions. Almost everybody's going to get these questions. Either get four of them, one out of the four of them, or three out of the four of them. And these questions are asked in different ways, right? Different perspectives. Your ability to identify them when they ask them, right, is another thing that we're going to train you at. So you got to
Okay.
pay full attention to listen to what they say. Sometimes it comes very
Okay.
simple directly. It doesn't go technical. Just tell me about yourself. Sometimes the tell me about yourself question, which everybody dread so much, does not necessarily come because you would have had the introduction either when you were having the chat. Hey, Steve, how are you? Where are you from? Okay, nice to meet you. Where
Right.
did you school? And then it goes that way. Or in the first session where they usually have either a day before or 1 hour before or pre the interview, you would have introduced yourself, right? You've met the program director. So he's not going to begin now to bother you, tell me about yourself when you've already introduced yourself to him.
Yeah. Okay.
You get it? So the
Yeah.
question will now go into other areas that they want to measure. The remaining 60% of the interview is now what I call the other questions, cuts across behavioral question, cuts across medically related question, because they are free to ask you medically related questions. Like they want to test, are you knowledgeable, right? They
Hmm.
want to test. So we tell people to prepare for cases, prepare for short case, prepare for long cases, right?
Good.
Case it comes up. Tell me an interesting case you've seen, for example, is a way to judge your medical knowledge, right?
Right.
Tell me a
Hmm.
situation where the patient was in acute care and you took care of the patient.
Wow.
Tell me a situation, a
Okay.
difficult patient. They could ask you ethical questions. What would you do in this situation? What would you do in that situation? What would you do in this situation? They could ask you situational questions, like I just said. They could throw up
Right.
anything. If you're a phone, what kind of phone would you be? Samsung or Android? If you're a book, what kind of book would you be? If you're an animal, what kind of animal would you be? So in preparing for an interview, we tell people, prepare for a book, prepare for a book that you've read, prepare for
Right.
an animal that you'll be, prepare for a tree. If they say what's a tree, prepare for situations. If you're a city that you want to visit, what city would you be? If there's something you want to change, what would you do? Those questions are, they don't have a yes or no answer or a
Right.
right or wrong answer. They're just trying to test your analytical skill,
Hmm.
right? The way
Well,
you,
what could be the objective of such questions and what
for example,
direction we should think about?
they said, if you're an animal, what animal would you be? They're trying to test your character. Let me give you how
Okay.
the answer goes. Like for me, if I was an animal, I would be a dog. You know why? Because dogs are
No.
very loyal. I'm a very
Okay.
loyal person, very committed to wherever I find myself. Um, so if I come to a team, I put in my best, I defend that
Hmm.
team just like dogs defend their owners, right?
Hmm.
I'm always there by the side. I'm there by the side of my patients, walking them through their different situations in their health problems, be it access to care, be it understanding their pathologies or diseases, be it, and then we're going to go through those when we get to that section, because in this our interview, this is like introduction. We're going to go through how to answer those situational questions and the
Okay.
principles of answering them. But I've given you an
Okay.
insight, right?
Okay.
Yeah. So they're going to ask you those, the 60% is like spread across, and they're over 1,000,000 questions. So don't worry yourself about 1,000,000 questions. What you need to worry yourself is what are the principles of many of these
But
subcategories
behind them. Yeah.
behind them. And then you
Yeah.
keep practicing as many, and you keep practicing. And I tell people, look, these days, this 5 sessions will not be enough. So the YouTube University is there, the
Right.
ChatGPT University is there, right? Your
Yeah.
spare time, you lie down on your bed, you just open YouTube. And that's why we're doing like this video now. Somebody will stumble across it and gain knowledge, right? And then
Yeah.
gain knowledge. And people are gaining knowledge on different people. People like us who are volunteering to give free information online,
Right.
free, credible informations, right?
Yeah.
You see so many of those scenario questions, just type them. How to answer, tell me about yourself in a residency interview. It's going to pop up. How to answer this, it's going to pop up. Go to
Yeah.
ChatGPT. ChatGPT has made things easy. How do I answer?
Yeah.
What are the common interview questions and what are the common responses? Put it there.
Yeah.
What
Yeah.
we do as professionals now is to now listen to you because you're not going to speak ChatGPT, right?
Of course. Of
You're going to,
course.
you're not going to be reading it. So we'll now look at your delivery, your composure, your content, and then we
Mhm.
tailor it to your unique, because ChatGPT may not tailor it to your unique situation.
Right.
That's
Yeah.
what we do.
Absolutely.
So
Absolutely.
in addition to these sessions that we're going to have, we're also going to do a mock session for you to actually put you on the actual interviews. The mock session is going to come from a strange person we never know, somebody who has worked in faculty leadership before, and then test your ability to withstand 1 hour of or 30 minutes of active um, um,
Interviewing.
interviewing, right?
Yeah.
I
Okay.
have gone through the basic introductions of this.
Yeah.
Thank you so much for volunteering for today's session. Other
It's my pleasure.
sessions are going to continue, and then we're not going to go into details of the questions, how to answer each, how not to answer each, what do you say, what don't you say, and the rest. Once again, my
Okay.
name is Dr. Kobe Edwards. I'm a family medicine physician in training, and I'm happy to, provide these services. I have a team, not just me, a team of over 10 doctors who are proficient in rendering this kind of service that are under our company and
Okay.
our team.
Okay.
And we can assign you to one of them. But I usually do the introductions, and then
Okay.
I do quality control for what other people do.
Okay. That's nice.
Are
That
there
is great.
any questions for me?
I think it's been nice and great so far. Hoping that by the time we dive deep into the stuff you mentioned so far, it might become more clear. For example, I think one of the problems that most people face, I mean, I face, I don't know about other people, is being able to relax at the beginning of the interview. As you mentioned before, the adrenaline goes up, the epinephrine and all of them. And if you're not careful, you could
You
just,
freeze.
yeah, and for most people. So for me, what it does for me is to say 1 million things in 1 second. And then you're not able to catch anything I say because I'm like, ooh, you're gonna stop because I'm not relaxed and I'm like, I don't know what is coming next.
So,
So
so for us, that's why we started this program, because we know that many of us are not traditional English speakers. So we kind of bring in these little tactics to help us relax. One key thing that I forgot to say also is to take your time. Don't run through your answers. I know we want to produce our answers in 2 minutes, 3 minutes, short answers, but I'd rather you take your time to say your initial answers
right.
and marshal your points, point by point, using transitional phrases. One other reason, another thing about me, the transitional
Okay.
phrases help you to relax, because then you're not
Okay.
going to be running through something about me that is exciting, something I do outside medicine. One of the things that I find very unique about your program, you see, those transitional phrases that you're going to use,
Right.
it
Okay.
slows you down, and then you go. And it's okay to, if you're tense, to say, give me 2 seconds to collect my thoughts. It's very okay to
Okay.
use.
Oh,
It's
that
okay
sounds
to
good.
forget something and say, I
Right.
really don't have an answer to this, but if I was put in this other scenario, this is how I'm going to measure it. It's okay. Let's say you've planned to say something in a sequence, and then you say sequence 1, sequence 2, then you forgot sequence 3 and 4, and then you only think you can remember sequence 5. It's okay to skip those 3 sequences and talk about sequence 5. And then when you remember the sequence 3 and 4, say, oh, there was something I was supposed to say when I was presenting this. And one other useful thing about me is boom, 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 boom. Don't think it's too late. Utilize it. So we use those ace cards. That's if you play card, we call them the queen and the king, the ace cards, right? We use those, those poker cards. That's right word.
Okay.
Yeah.
Okay.
But you're not going to be using that system all the time.
Right.
One or twice. Oh, there's something else. When I was talking about this, Dr. John, do you mind if I just tell you, when I was talking about it, there was something unique about me that I forgot to say. I don't know if it's going to add value to your assessment about me, but it is this.
Okay.
Okay. So that remember that it's okay to make mistake, and they also expect you to be nervous. A good interviewer calms you down. Say it's fine.
Yeah. Yeah.
But some people don't have that time. They're running. The last thing I want to say is that there are different types of interviewers. Some of them will be playing with their phone or with their laptop, or they're doing something, they're not paying attention to you, or they're doing something for different reasons. Either they don't care, or they really care and they're shy people, or they are taking note of what you're saying and writing. Right?
Okay.
And some other people are very engaging, and then they're engaging, they're interested in you. Don't expect everybody to be interested in you or like you or be engaging or like.
Absolutely.
So your
Absolutely.
role is to focus on your plan. I have series of things I want to sell about myself. I have series of talking points. I need to be delivering them in the most benign, happy, leisure kind of, not leisure, in the most professional demeanor. Whether he's paying attention to you, whether he's not paying attention to you. Don't stop because he's doing something and say, oh, are you listening to me? Can you hear me? All those things. Yeah, you may do that if he cannot really hear you, if you notice that he cannot really hear you, right? But he's hearing you or he's not interested. Okay, all the two.
Okay.
Right?
Okay.
So control your part. No,
exactly.
he's not listening to me does not mean that he's not paying attention to me, does not mean that he doesn't like me. Does not mean that he doesn't he's not enjoying what I'm saying or I'm not making points.
Exactly.
Right? That's his lesson.
Yeah, his attitude should not change the response you're supposed to give.
You're supposed to give.
Yeah.
Because some people you may be looking for them to be agreeable to what you're saying. They just have a bland look.
Right. Right.
And then you'll be talking, you say, all this I'm saying, I'm not even impressing this guy.
Yeah.
That does not mean that he doesn't think that you are good or not.
Exactly. And that could be the person's personality.
Yeah.
And
yeah,
you can just change him overnight.
Absolutely. So thank you for this session. And then